We want to thank you all for being here today. We're going to go ahead and get started. Thank you once again for joining us. We appreciate your time here in the Billings community. My name is Stephanie. I work with Big Sky Care Connect as one of the outreach coordinators. And today we're going to be talking about Big Sky Care Connect, our health information exchange. Just a few key reminders to please mute your phones and computers. Also, we'll use the chat function for questions, and feel free to ask questions throughout. At the end, we'll have a Q&A session where we'll make sure that your questions get answered. Also, don't forget to join us and register for the Big Sky Care Connect annual conference on November 5th. We are going to post that registration in the chat, and so you can register. It goes into a deeper dive about the HIE, what we're going to talk about today, and is a fantastic way to learn more about HIE, and specifically our statewide HIE here in Montana. Also, Big Sky Care Connect has a website and also has a newsletter. So be sure to register and you can see what's going on with our statewide HIE. So the real purpose of being here, we just wanted to introduce you to Montana's statewide health information exchange and let you, our audience, explore. Like I mentioned, I'm a Montana clinician. I live here in Billings, Montana, and so I'm in the trenches with you. I know that there can be a great challenge with care collaboration, with communication. So that's why this is such an informative tool, a helpful tool for both patients, providers, and clinicians, and such a valuable tool for us statewide. It's a great solution to what we're going to talk about today, about our pain points and our challenges. And so let's dive in here. So what is health information exchange? Oftentimes you'll hear us call it HIE. And why is it important to Billings Healthcare? Like I mentioned, being a clinician, I know the challenges, but I want you to think of a time where you had a patient and you didn't have all the information that you needed to make your next step, or you needed more information to just be cautious to make sure that you made the right next step. What was that like? Did it cause any delays? Was it a medication list that you didn't have that was complete or wasn't accurate or up to date? Did you need to know about a scan or possibly even who the patient had been seeing prior to you? These are all things that create such challenges in our healthcare environment. One provider who registered had wrote just 30 to 50% of the records I request from outside facilities ultimately make it to my desk. That's a great challenge. I remember working at a place and their medical records had stacks of papers, and anytime I had to go look for anything, it was in a stack based on months, and then I had to go searching for it until it was scanned into our EHR. That was a great challenge. The time taken away from my patient. That was a productivity that I could have had if I just had those moments back. So we asked each of you, as in your registration, what is your biggest pain point in obtaining patient data from sources outside of your healthcare facility? The number one pain point, access to information. We have a real struggle with interoperability within our Billings community and statewide, being able to collaborate and discuss patient information securely and efficiently. Number two was cost, duplication of services. Oftentimes we're trying to put together puzzle pieces because we don't have everything in front of us. We don't know what's been done previously. So that leads to duplication of services. It drives up costs, frustrating for the patient and for the provider. Number three was lack of complete or accurate data. So once again, incomplete medication lists. Maybe we don't have all the information in front of us, such as scans or labs or anything. And so oftentimes, and I've done this before too, is we rely on families to tell us what's going on with the patient. We know that this can often be incomplete, and we know sometimes it's not even accurate. Just keeping that in mind, something that you've experienced recently. What's our solution? The Health Information Exchange, Big Sky Care Connect. The HIE allows for collaboration from all healthcare specialties. I know we have people that have registered that are from schools, specialty clinics, hospitals, and private offices as well. So we want everyone involved. Also, patients deserve transparency and the highest quality of care. So I put Miss Agnes there. That's our patient today. So we went into healthcare to take care of people. Miss Agnes could be our grandparent, could be us, maybe in a few years. We think about our children that are involved as well and all of our families. This is what drives us to have quality care, to take care of our patients. But we can do so much more with the HIE. Since the vast majority of Montana's landscape is rural, we can bridge the communities to create a tighter, more collaborative care for these patients, for our families, and for us. Imagine Miss Agnes, she's at home and she's showing signs of a stroke. Her husband calls EMS. EMS treats her in the field, takes her to Billings Clinic, and she's admitted. She's proven that she's had a stroke. And poor Miss Agnes, she also has to have some continued care at Advanced Care Hospital of Montana. So just think about those care transitions and right now what we're dealing with and the lack of coordination, the struggles with trying to find the right resources for Miss Agnes. That's very challenging. But with HIE, we're able to do so much more. That's not as frustrating for her and much, much easier for us as clinicians. So who are we? Big Sky Care Connect. We, first and foremost, are committed to providing trusted real-time health information through this HIE. Big Sky Care Connect was established in 2018 by a diverse board, and representation is vast, from payers to providers within the community, also patients and businesses. We wanted to make sure that everyone's voice within Montana was heard. As you're likely aware, we've also had a past attempt at standing up an HIE. Looking at that past experience, you're probably asking, and many do, what makes this different? Why will this be successful? And to that I say there's a lot, actually, that will make this successful. First and foremost, we are endorsed by Governor Bullock. Also, we have partnered with InterSystems, the global leader in HI technology. We'll talk a little bit more about them and why they're so important as well to this collaboration. Also, lessons learned from other states' HIEs. There are many states with successful HIEs. Learning from their growing pains, also learning from their successes is just as important. And then learning from our past experience. We all grow, we all change. So learning from these experiences are very important, and this is what will make it successful. So how will Big Sky Care Connect support Billings providers and patients? So we just spoke of pain points, and I appreciate all of our audience for being so honest with me. I don't love to hear the struggle, but I know the struggle well. But I can tell you that Big Sky Care Connect is a call to action for all of us in Montana. It's a call to action to provide a solution for the pain points that we just talked about. It's an access to comprehensive patient history at the point of care when we need it most. It's collaboration, which we have a little bit, but it's just old methods. We have a new method now. We can reduce costs by avoiding duplicative services. That's great for the patient and for us. It save us time. We can save time and money by not searching for those records that I was just telling you about. And we can spend our time where we want to spend it. We want to spend it with the patient. We can be more productive with them. We can provide better patient care. So why is it important that everyone joins Big Sky Care Connect? I often get this question, and why should I join? Why should anybody join? Do you really need everybody participating? And the answer is yes. Think about it. If we had all of our community and all of the state join in to HIE, think about how robust the data would be. Think about how valuable it would be to your facility. We'd have this information at our fingertips to make the care transition so much easier, to have all this information right in front of us. Our poor Miss Agnes, she has a care transition that's much more seamless, and the provider doesn't have to pull their hair out trying to figure everything out, fill in the gaps, putting the puzzle pieces together. This is the answer for Montana, and this is what we've been trying to achieve throughout healthcare for several years now. This is Montana's turn. How does Big Sky Care Connect work? So another pain point that was mentioned on registration was security. And I have to tell you, that was my question when I first joined as well. How secure is this? And so a lot of points that are mentioned on this slide, but rest assured, this just shows that BSCC has diligently provided a secure platform for patient collaboration and information. Big Sky Care Connect is not only TEFCA compliant and high trust certified, it also protects the 42 CFR data, sensitive data for behavioral health, and it keeps it secure within the system. Those who should access it can. And also it's encrypted. All information is encrypted at rest and in transit. It is powered by InterSystems, which is known for its reliable and secure measures as well. These are our core services, which there's a lot there. It's fantastic core services that are being brought to you at Big Sky Care Connect in partnership. We're also working with state officials and connecting labs to Big Sky Care Connect so we can receive real-time results in our HIE. And it wouldn't be nice, we think about our patient, Miss Agnes, wouldn't it be nice to know if she's had a recent COVID test? I know during the pandemic, that's been a great challenge is knowing results, knowing who's testing positive, who's negative, how do we get that information? In addition to all these core services, we also have partnered with Collective Medical for their emergency department optimization program. And their program has been proven to help hospitals reduce unnecessary utilization for the emergency department and also reduce lengths of stay. Great return on investment there with this collaboration. It also improves care for our most vulnerable patients, and we can identify, track, and coordinate for patients with or at risk for COVID-19. The eHealth Exchange is also something that we'll be connected to soon. The eHealth Exchange connects us throughout the nation to other health information exchanges, also the Department of Defense, as well as the VA. And it's a great tool, like I mentioned, for the safety and well-being for our patient, but also for clinicians. With the single sign-on technology, we're able to one click be able to get the information we need at the point of care. I remember I used to count clicks until how many clicks would it take to get to the information that I needed. It was a challenge. It took a lot of time. Productivity was lost, time with my patient was lost. But this single sign-on, the information is right there. One click, it gets you right into the system. So you're looking at this screen and you're thinking, no annual subscription fee. Well, that's a typo. It is not. No annual subscription fee through September 2021, all covered through the high-tech grant, no cost to you. And then if you look on the screen as well, included in onboarding services, even change management to help through this transition, brought to you by FutureSync International, that's also something included. These are great services that partnership will allow you to be able to be successful with utilizing this tool to get the information that you need to make life much easier. In addition, as I mentioned before, we've collaborated with Collective Medical. The Montana Hospital Association has grant funds for this connection for the Collective Medical Emergency Department Optimization Service at no cost for 2 years. So this is a great time to join, where you can see the true value of the HIE, and then there's no bill coming to you right away. This is truly a try it before you buy it. We joke around on the outreach, it's try it before you buy it, but truly you can try it before you buy it. This is a list of our Big Sky Care Connect participants, our current list. The blue is in Billings. And so you look, there's behavioral health, there's clinics, specialty clinics, all sorts of community providers. This is what we're looking for, true care collaboration through our community. So a call to action to you in the audience, I encourage you to reach out to those who you partner with, those who you refer to, and encourage them to reach out to us at Big Sky Care Connect so we can speak with them as well and tell them why Big Sky Care Connect is so important to our community here in Billings and throughout the state of Montana. This is a true value to both you and to all of Montana. So the next steps would be to submit an application after you speak to one of us, and we can tell you more about it. One of us meaning outreach coordinators. Submit an application and a participation agreement, as well as the business associate agreement. And then once the Big Sky Care Connect board approves, our outreach coordinators will complete an intake assessment. That just lets us know more about the technical pieces that you have within your facility and how we can best help meet your needs. And then the outreach team will introduce you to our very talented technical team, where a technical discovery call will be conducted. And then the outreach team will also introduce you to change management, Kurt Swenson with FutureSync International and his great service, interface build and testing, and then the exciting part with the go live. Our outreach partners here, all Montanans right here with you. Ah Young Huff, she lives in Libby, Montana. Haley Peterson in Polson, Montana. And then myself, Stephanie Sullivan. I live right here with you in Billings, Montana. We're here through every step of this connection. Reach out to one of us so we can tell you more about how we can meet the needs of your facility what we can do to help to make sure that we have the collaboration in Montana that we've been seeking. And with that, I am very honored to have this roundtable with us today. This roundtable discussion, I'm going to introduce people from our own community, from right here in Billings. John Felton, CEO, Riverstone Health and Yellowstone County Health Officer. Thank you for being here, John. Christy Gatrell, CEO, Bighorn Hospital Association. Thank you, Christy. Lynette Kosovich, CEO, Rimrock Treatment Center. Thank you, Lynette. Dr. David Mark, CEO, Bighorn Valley Health Center. Thank you, Dr. Mark. Judy Powers, CEO, Advanced Care Hospital of Montana. Thank you, Judy. And Dr. Randy Thompson, CMIO of Billings Clinic. I'm going to stop sharing my screen because I think it's important that we can see what's going on with our panel here. And so I want to start a conversation with our panel and just let the audience really know what really drove this panel to connect with Big Sky Care Connect. So the first question that I have for our panel, if you guys don't mind weighing in, is as we approach go live of our statewide HIE, we know that Big Sky Care Connect will bridge Montana communities and provide for real-time sharing of information and provide better health care for all Montanans. What were the deciding factors driving the decision to connect to Big Sky Care Connect?
So this is John Felton. I'll go ahead and kind of tell you our story. Part of it has been that we operate a residency program that has residents in multiple hospitals, and so they need to be able to sign on to all these different systems individually as opposed to trying to just get a patient's record. In Billings, as a lot of us know, we do have a lot of patients who go to many of our facilities and sites, but that information is pretty scattered. The other one is a little more on a personal basis. It really hit home when we had an employee who was involved in a very serious accident on the other side of the state and rendered unconscious. And it becomes really clear then how great it would have been if someone could have just pulled up that person's record and found out what their allergies were and what their diagnoses were and what their medications were and all those sorts of things, instead of having to figure it out with an unconscious patient. And it's that kind of risk reduction would really be helpful. So I think it's a really important way. You know, we always talk about Montana as a small town with really long streets, and that's certainly true in our healthcare communities as well. So I think the opportunity to understand what's going on with patients in real time is really valuable.
This is Lynette Kosovich, and I can talk a little bit about how behavioral health is so excited to be part of this initiative. Over the last decade, I've seen people come in with seeking help for their addiction or their mental health and their comorbidities, and just the general health of people really have deteriorated over the last 10 years, or maybe even longer than that. And we've made it a policy in our organization to really obtain all of their medical records, their physical medical records, to make sure that we're providing holistic care. And this is that opportunity that's going to make it a lot easier. Just like Stephanie said with the patient Agnes, you know, it's very often difficult to get those types of records in a timely manner. And it's just going to give us the opportunity to really up the game in providing quality care.
This is David Mark. I would sort of echo what everyone's brought up already, and just point out a few, just three, I guess, additional points that were really compelling to us. The first is, you know, in this, as our world shifts inevitably towards our value-based payment reimbursement model, having access to quality measures, to data that will help demonstrate the quality of care that patients are receiving is vital, and having sort of access across systems really facilitates that goal. But we take care of a lot of patients who, you know, who are not well-to-do, who are underinsured or uninsured, and so the notion of reducing costs that patients may have to face themselves because their deductible's too high or because they don't have insurance is really important for our community members. And so having access to lab tests, for example, that might have been done but they didn't know about, that's really important when it comes down to individual patients getting the care they need. And then one third thing that I would mention is that we anything that we can do as an organization to improve the experience of our clinicians who are taking care of patients, to reduce their load, to minimize the death by 1,000 paper cuts is going to make them more resilient, is going to reduce burnout, is going to improve retention of our most valuable asset as an organization, which is our people. And so, for us, the HIE it's a no-brainer for all of those reasons, in addition to what's been mentioned before.
This is Judy Powers, and I'm the CEO at Advanced Care Hospital Montana. We're the only long-term acute care hospital in the state, and hopefully everybody can hear me okay. Okay, good. We have the advantage of taking patients from all walks of life within our state and every single community. And what we've seen, in addition to the necessity of accessing all of their patient records, because most of the time these are really the sickest of the sick, lots of comorbidities, have seen lots of other providers before they come in to see us, we also need to get these patients back into their home community. And it's really a complication when we're trying to connect those dots for the primary care providers, the behavioral health specialists, or the healthcare systems that we're sending these patients back to. We communicate currently by paper, and we know that paper goes right into a stack with thousands and thousands of other pieces of paper. And therefore, there's duplication of effort, there's confusion for these patients, and there's disconnects that cause patients to have to access healthcare again when maybe we could have avoided it in the first place. So for our providers, they spend about 1 hour for every single patient that we admit to gather as much information from other healthcare systems when they come to our facility. 1 hour of time that our providers are spending. That's a lot. When you take that and you start to think about that burnout, the need for resilience, and the duplication of efforts, to reduce that, even if we can drop it to 10 minutes, that's a big deal for our providers. And it's also an efficiency, and then our providers and caregivers can be at the bedside for a lot longer period of time.
Yes, Randy Thompson. I just want to echo what everybody else has already said. I don't want to spend a lot of time talking about that, but it's really about the patient. Having immediate access to the data that you need in an emergent situation, but then also having that holistic picture of everything about the patient that has been created, no matter where they're seen. And it's kind of amazing. We've spent a lot of time creating a system at Billings Clinic to gather data. And so I have more immediate access to data if a patient's seen on the High Line in one of our facilities than I do across the street. So I can't get access to information across the street, but I can from the High Line. And so it's just amazing that we don't have that yet. And that's why we're really interested in this.
Great points. And I appreciate everyone's involvement with that. That was very, very nice to hear your intake on why it was so valuable to your facility. Thank you. Great points. My next question, this is for anyone. We all know that when providers have complete patient record at the point of care, they're able to provide more effective and efficient care to their patients, leading to a much better experience for both patient and the provider. How can the Billings Healthcare community leverage Big Sky Care Connect to improve the quality of care and overall experience for both patients and providers? We touched on this a little bit, but then also I kind of want to throw a little extra in there, if you will. And then also with this care collaboration and the overall experience for providers and patients, how do you anticipate Big Sky Care Connect will help with our COVID effort right here within our Billings community?
John, you want to take the COVID question?
I get a lot of
Thank
COVID.
you, John.
So, one of the things that we're learning about COVID is that it can be, it appears that people can become reinfected. We're pretty certain that long-term immunity is not conferred when you have COVID. It just is similar, like you can get colds repeatedly, or unlike, say, measles, for those who have measles as kids, we can be pretty confident we're not going to get measles again. So one of the things that plays into this is, let's think about quarantine. So if a person had COVID and was confirmed, and you could just easily get that record, if they were identified as a close contact within 90 days, they wouldn't have to quarantine again. But right now, nobody has access to that record unless they happen to come back to the same place where they had their first test. So it would be much easier to know. And the other thing that I think a lot about in terms of the COVID is what we do know about this disease is that people with significant underlying disease are at much higher risk. So again, if you imagine the example of if I go to, let's say, to Missoula for something and I become ill and get tested for COVID, it would be very helpful to whoever's checking me out in Missoula to know that I also have X, Y, and Z as underlying chronic diseases. And right now we don't have access to that. And I think one of the things that Dr. Thompson touched on there is, he has all kinds of data about patients in his system, but not someone across the street. And we're, I don't know, 8 blocks away or something, and he really doesn't have access to our information. But we know that our patients go to multiple hospitals, multiple emergency departments, multiple same-day cares, multiple primary care practices. And right now, each one of us can see our own little slice of that. And so that the ability to actually look at a patient in total would be dramatically helpful and probably reduce a lot of duplicative testing and those sorts of things. So a lot of good reasons to do it.
Thank you for taking that one, John. I appreciate it. And I've always seen the value within HIE of just having a statewide exchange like this. But I think just to your point as well, I think it's been intensified now that we have a pandemic going on. And so thank you for your points. I greatly appreciate that very much. Our next question has to do with care transitions. And I know, Judy, you deal with this quite a bit, and anyone can weigh in on this as well. Care transitions for a patient and care team is the chain that drives care forward for a patient. Knowing the challenges that care teams and families face during this transition, how do you anticipate connecting to Big Sky Care Connect will help care transitions in our community?
The short answer is that you don't have to do as much research if you have a natural electronic connection of information. So for example, when we bring a patient in from another level of care, which is 100% of our patient population, if we have access to that information through the HIE, we don't have to make phone calls. We don't have to talk to the family and rely on historians to give us all the information. We have accuracy, and therefore you reduce duplications, you increase efficiencies. And when we're sending patients back into the community, we really truly do rely on the patient and the family communicating items. We rely on people being able to see the piece of paper that we send across their desk. And we rely on telephone calls to see how those patients are doing once they discharge from us or to communicate information. And we miss a lot of opportunities to continue the education that we've done for the 25 days on average that they're in our facility. And we rely on the primary care providers' offices to pick up that baton. This will help shorten that time frame and will help ensure that communication is happening all the way throughout that chain with the patient's best interests in mind.
And I would just point out that typically when Agnes leaves Judy's facility, she comes to the swing bed at our facility in Hardin. And I marvel that the so-called electronic transmission of information that we sometimes experience still involves a fax. It's an electronic fax, but it's still a piece of paper which may get filed in the right place in the EHR, but may not. And so the advent of actually real electronic information transfer is going to be such a welcome relief for these kinds of transitions, which happen every day.
I think the other thing to keep in mind is we tend to think pretty readily about a care transition from an acute care hospital to a long-term care facility or acute care hospital to rehab or long-term acute care. Remember, there's all sorts of other transitions, home care, hospice, outpatient treatment. Right now, every one of those sort of stands alone. And so we're back in exactly what Judy said. We're faxing papers and hoping that it gets to the right place and the right person reads it. But we have a lot of levels of care and sites of care that aren't just facility-based. They're going on in other places. So we need all that information available for all those transitions.
So if this becomes hardwired, it just becomes so much easier for the whole system. For example, if there's a patient in a tertiary care center that's going to advanced care or whatever, and there's 4 or 5 different entities involved in the care, they don't need to wait to see the patient look at their chart. They can log in and start looking at the chart and the information all at the same time, even before the patient arrives there. So it just creates this immediate access to all of the information that they need. And coming back to the paper, when we get a transfer in from some hospitals, we get maybe 80 to 100 pages of medical records with them, and somebody's got to sort through there and try to find that one piece of data that's really important, and it might get missed and it might get dropped, and then it doesn't get scanned in for a while. And it's just problematic, first of all, to sort through all of that paper and then rely on somebody to scan it and put it in your system eventually. So that's going to help improve that from that standpoint as well.
You know, and just to add another little anecdote, we had a patient that we admitted yesterday, and the patient's wife was upset with the primary care provider for DCing a medication that she felt was necessary for this individual's pain. And our pharmacist spent about 35 minutes making phone calls to different pharmacies to get accurate information to find out who was the prescribing provider, so they could then reach out to that provider and find out what really was the story, versus just having that provider reorder the medication and not have it be the right outcome for the patient. So it's a real example of what we go through today when we're trying to get patients in. And good or bad, we are one individual hospital that is not connected with any of the other systems in the state. So we really are on an island. We have to do a lot of legwork and hope that our partner facilities can get us access either into their system or that we can connect with the right person to get the right information. We can't exist on a hope in this day and age. We need accurate information.
You all bring up great points. And like I mentioned when I was presenting, you know, working at facilities where you have just papers upon papers and just piles, and you have to go searching through that. I mean, it is the most frustrating. And we do it for our patients. We do it because we care, but we want to make the right choices. And it's such a challenge. And you guys bring up great points. I just remember that time. I wanted that time back. I just want to be with my patient, but I'm searching for a paper. And so I know that frustration is very real. You bring up a point, Judy, that is great about, you know, a lot of times, especially in rural Montana, we feel like an island a lot of times. This collaboration becomes such a challenge. I know Christy with Bighorn Hospital Association, well, let me back up. How would you see care collaboration being so great for like more of a rural setting? And two, who would be your ideal people involved? I know we said everyone, we want everyone involved, which is true, we do. But especially for the rural community, who would you encourage to join?
I think it'd be fantastic if there was a way to get the IHS, the Indian Health Service, on board. I know there's been issues with a barrier, I guess, for being able to have access to their records. But we see so many patients from that area, and I know that they're also being seen in Billings, and just being able to have that continuity of care. You know, and hearing what everyone is saying, I mean, frustration is so heavy on both sides. The providers are frustrated with not being able to see the information, and patients are frustrated because they're like, well, they told me they sent that information, but once again, we're relying on a fax machine and hoping that the paper didn't run out or it didn't jam or all those little things that always go wrong. But yeah, I think it'd be fantastic if we could. Now, if I'm understanding correctly, the VA, we are able to see their information?
Yes, and that's not a day one. There's quite an extensive program to get the connection to the eHealth Exchange. And the eHealth Exchange is what has the VA data. And in addition to the Department of Defense and also the other statewide HIEs as well. So yes, that is coming.
Yes, so I just think it'd be a great benefit if we could get IHS to the table.
I'm actually glad you mentioned that because we are talking with Urban Indian Health Alliance and also with the Native American Development Corporation. And we're talking about, you know, creating a consortium or an alliance to be able to reach out to IHS as well and collaborate with everyone within the Native communities, so that you're exactly right. We can have true collaboration with all communities within Montana. Now, you brought up a great point, and I appreciate that very much. My next question has to do with, so we've mentioned 3 pain points. with obviously lack of collaboration, cost being an issue as well, and then non-comprehensive data being our main pain points now. Anything that you guys want to bring up as far as any of those 3 pain points and how how BSCC HIE could be a solution for that? I know we touched on it a bit, but particularly with cost, how do you anticipate BSCC being able to help you?
And I think that the most immediate benefit from a cost perspective is going to be if we know that a patient just had a CT scan of their abdomen and they show up at a different ER, we can see that, or reducing the duplication. I think that when we look at patient safety, though, there's huge potential for savings in the patient safety realm. Again, if you know that a patient has allergies, or a patient has is on certain medications, or has certain diagnoses, if you know that up front, then our providers can make decisions based on the current status of that patient, instead of having to kind of figure it out as they go. So I think lack of reducing duplication and reducing medical risk by knowing that information can be a huge benefit in terms of total overall cost of care.
Anything? Oh, go ahead, Dr. Thompson.
There's probably a longer term savings in there that kind of touches on John's point of just access to relevant data. So if a patient had a pap smear and they were seen at a facility in the western side of the state and it showed some abnormalities that really needed to be followed up on, and the patient didn't really appreciate that, and then they moved to the eastern side of the state and forgot about it, and then didn't see a provider for a while and didn't complain of anything that would require them to get another pap smear. If that provider, though, had access to that information, they could potentially prevent a problem just by having access to that information. And for us to do population health effectively, we need to know all of the information about a patient in a holistic manner. So we really need all the information that's generated from all the facilities and from the payers themselves, and all brought into one place so we can look at that data about the patient holistically.
Excellent points. And then you hit on a point that I definitely want to discuss within this roundtable, and that is payer involvement within Big Sky Care Connect. There's lots of rumors floating around, but we know that payers being involved in helping those care transitions are just as important, making sure that the patient receives the care that they need. Anyone on our panel, how do you anticipate payer involvement to actually help with HIE and help with your efforts for quality care?
From my perspective, the payers also have data on patient care that we may not have access to, whether it's prescriptions that have been picked up somewhere or an office visit that was done in a location. Being able to see that might allow us to dive in and actually access that information that we may not have known was there before. Hypothetically, also, it'd be great to have some more efficiencies in the prior authorization process. It would be great to have payers have access to some of that clinical information, so we're not relying on, again, fax machines or communicating in methods that might not contain all of the accurate clinical information to make the best decision for a patient. It's a very inefficient process right now, and to gain some efficiencies there, in my opinion, would be a win-win.
Absolutely, absolutely, and thank you for that, Judy. Lynette, as far as the behavioral health component within Big Sky Care Connect, we talk about holistic medicine and making sure that we're providing care for the whole patient, and behavioral health is commonly missed. How do you anticipate this care will help our behavioral health patients in making sure that the community and their primary care and things are well informed?
Well, currently our patient population, approximately 67% of it comes from outside of Yellowstone County. And again, we go back to that antiquated way of transferring communications regarding that patient's health. And it's inefficient, it's dangerous, safety factors not always there. But it just is going to give us that opportunity both in admitting a patient to make sure that we have all the necessary information, particularly now with so many people on a variety of pharmaceuticals, and making sure that we're safely treating them based on what they're taking for their health currently. And probably as important is when we transfer them back to their home community, that continuity of care. I don't think we can underestimate the amount of patient satisfaction this will give. Just like Judy had mentioned earlier, when you're dealing with people that are scared, often it comes out as looking angry. And it's often really, the root cause is traced back to not having enough information. And I think having this kind of system in place is really going to ensure that we can, we'll look smarter. And I think our patients will be the ones that'll benefit.
Absolutely. Well stated. Thank you for that. Thank you for that. Any last words anyone wants to say? We're going to open it up to the chat and some questions here in just a moment. I want to make sure I give everyone a chance to say what they like. Thank you all. Before we open it up, I just would like to thank you to our panel. You guys have been amazing. Thank you for answering questions today and being willing to take the time to speak with us here. We appreciate your expertise and also what you're doing for our community. And that goes to everyone in our audience. Thank you. I know this is a very large collaboration, trying to get everything together with COVID, making sure our communities are safe and well cared for. And we thank you, truly, from the bottom of our hearts. We thank you for all that you're doing. It takes a village, a state, federal agency, you know, everybody involved. So we appreciate everyone. We're going to open it up to the audience. First, before we start within the chat, any questions for our panel from our audience? Feel free to unmute if that's easier. That's fine too. All right. Well, let's go ahead and get to our chat. Whoa, we've had a lot going on in the chat. All right. Rachel had asked, in regard to COVID testing results, would results be available regardless of where the individual was tested or only if tested at a participating facility? That's a great question. And the answer to that is you can see the information within the HIE for those who are participating within Big Sky Care Connect. And that was the part that, that we'd mentioned. Of course, our panel mentioned it and I mentioned it as well. Why this collaboration is so important for everyone to be involved is for that reason, is that the information is more robust, obviously. It's more comprehensive for the patient and all of the community at large. And it also helps us with those care collaborations, specifically with COVID testing too. So the results would be for those who are participating, and we're working on ways for analytics as well, both state and locally. And so we're investigating those as well. Did that answer your question, Rachel, or did you want me to have any follow-up questions? It did? Okay, she nodded yes. All right.
And Rachel, I'll just add into that. When it comes to the testing, we are working closely with the state labs and their reference labs. And so we anticipate having a direct connection for those test results to be available. Additionally, we also are looking at LabCorp and Quest. And so those additionally lab tests would be available regardless of that participating provider.
Thank you, Jean. And I appreciate you being on this call. I'd like to introduce Jean. She's the acting CAO of Big Sky Care Connect. We appreciate her time today. Thank you. Rachel, did that help dive in a bit deeper for you and answer your question okay? Yeah? Okay. All right. For schools, when dealing with children, would parents need to sign permission with the provider to allow the child's information to be entered in the system, similar to the Imatrax immunization system? Jean, do you happen to know the answer to this one within our Big Sky Care Connect?
You know, in the chat, I answered in regards to how we visualized, and Rachel, you can provide input on that, but we really saw that school nurses would be viewing the information. They would not be contributing any kind of PHI into the system. So they'll have that ability through that sign up, and we have a participation agreement that lays out, what access and what data access you would have at that particular point. But good question on regards to the consent of looking at that information. That provider that would see that patient, for example, a child giving the vaccination, and if that happened over in John's shop at Riverstone, they're going to be getting that consent form and know that that information is going to be shared with the HIE at that particular time. In regards to you needing another layer of consent, that might be another legal question we need to pose to Justin on our side.
And I can follow up with you, Rachel, as well. Go ahead.
Well, I was going to say, there was a comment in there regarding opt-out versus opt-in. So what we are looking at is in our notice of privacy practices, indicating that we will be participating in the health information exchange, allowing people to opt out. They can make that decision, please don't include my information, but making it really a routine part of the notice of privacy practices is how we're going to approach this.
And thank you for that. And you brought up a great point, John, and I appreciate you bringing up that point. In that Montana is what's called an opt-out state, meaning that everyone is in the HIE within the state of Montana, and you do have the option to opt out. We have a policy, we have a form and information for the patient, so that every facility will have this information for any patient and every patient that comes through, should they choose to want to opt out of the HIE. So for our audience, I have a question. Is there any sticking point or anything you've heard through the grapevine that you want to address with Big Sky Care Connect, one of us, or also with our panel? Any questions for our panel as well? And feel free to unmute if that's easier. All right. So when wanting more information about Big Sky Care Connect, I had mentioned Young and Haley on here, and in just a moment here, I'd like to share this, our information with you again, just so you have it.
Hopefully another question come through, Steph.
Oh yeah, go ahead. What does it say, Haley? Thank you.
So this is from Rachel too. She just had another question in regards to schools. So for school nurses, the most valuable information for us is to have access to information regarding a student's diagnosis and medication list. And also during this time, of course, COVID results. Would this information be available with access that would be given to school nurses, so that view only?
Yes, and it will be view only, just as you said, and the immunization records will be in there. I know right now I have kids in school as well, so I know exactly, in Billings Public Schools actually. So I know that the challenge is, you get the big stack of papers and the parents have to fill it out, and oftentimes it's not filled out, and oftentimes the schools don't know immunization records. COVID would also be involved with that as well. You would have full information that you need at your fingertips. The nurses would have that. And so once again, it's not anything that the nurses would have to input any information or data. It's more from just a safety standpoint for both the student and for, of course, the school during this pandemic as well. The other thing is, I know, that we have a lot of, and this is everywhere nationwide, there's a lot of students that are very delicate, either frail diabetic or needing medication while they're at school. So that would be another reason that the HIE would be a very valuable tool, is just knowing exactly what the patient is on, the student, full medication list, any updates to that list. Oftentimes I know with ADHD medications, there's adjustments made. So having that information for those nurses is very important. And once again, insulin, making sure that we're up to date with what's going on with the primary care for a diabetic patient is very important too.
So Rachel, I'll just add, so within our system, we have two roles. We're going to have a role where individuals can see the information, but we also have in Montana, obviously, the additional layers of protection that are needed for behavioral health, and then sensitive information that's in Montana's laws like STDs, HIV. And so a role will be assigned based on the ability to access that information, and you'll have to break the glass, so to speak, to get to that sensitive information. So just because you get view only, you're not going to have anything less than anyone else in terms of the viewpoint. The other piece, I mentioned the connections we're doing directly with labs. The other connection is that we're working on now that should soon be available with the initial launch will be our contract with Doctor First. And so that brings in the whole medication history for that patient. So you're going to be able to see what that individual has been prescribed and what they've also been dispensed. So you're going to have that kind of rich information right from the get-go through the health information exchange.
Thank you for that, Jean. I appreciate that very much. Kelly had mentioned too that we will also make the recording from this round table available in the near future. For the panelists, do you have any ideas on how we could get more participants in Billings so we have better data in the HIE?
You know, I think part of it is just sort of the willingness to step out and do this. We do have this opportunity where this is funded through the Medicaid program and the 90-10 matching grant. That's time limited, but it is that, as you said, Stephanie, it's the try it before you buy it opportunity that we don't get very often. But I think there's, you know, we know there was an earlier attempt to do an HIE that didn't go very well. We learned a lot of lessons from that, and we are sort of managing this one differently. So I think it's really just sort of stepping out and encouraging our fellow organizations and providers to sign up.
I would echo what John said, and if you are a patient at a practice or at a facility, reach out and let them know how you feel, and let them know that you would like them to join the HIE so their data could be shared with everybody. So I think you have power at your disposal to do that. Absolutely.
Great points. Great points. I once worked in a state that had an HIE, and I remember having a patient. And this particular facility, I'd heard through the grapevine this story, but this particular facility wasn't signed on to the statewide HIE. And this patient says, "Don't you have that thing, you know, that where you can get all my information just like at push of a button, like it's all right there." So once the patients know about it, it makes it one real for us as providers, because we always think, well, our jobs would be so much easier, but the patients know about it too. They know the valuable tool that it can be to have their information throughout the care continuum, making sure all providers have it. And so we can provide better care that way. And I think patients see that. I think it's a very valuable tool for them as well. You're right about the funding as well. The funding doesn't last forever, but the try it before you buy it. I mean, it's just, how many times in our lives do we get that chance to try it before you buy it? I mean, maybe like a test drive for a day for a car or something, but not really months upon months of being able to see the true value of something. So this is a great opportunity for that. In the chat, we've posted the newsletter as well as sign up for the annual conference. We just wanted to remind you of that. Any last questions before we depart? And while you think on that, I just want to let you know that we as outreach coordinators, Haley, myself, and also Young, we're here for you. So if you would like a presentation to your facility, if you just want more information, we're happy to help in any way that meets your needs, and we're here for you. Any participant that we have, we make sure that their questions are answered. They can always reach out to us. We also make sure that we follow up with them as well. You know, we all have learning that we have to do as far as being able to know more about your facility, because each facility is different. Each organization is different. But just rest assured that we're here for you. We're here to answer your questions and concerns, and we're here to guide you through this. So with that, I just wanted to be aware of everyone's time today. I want to thank our panelists for being here. Thank you for your time today, your expertise, your knowledge. We appreciate everything. Thank you for BSCC for your time as well and your input. And we want to thank our audience. We appreciate all your time, and we truly hope that you reach out to us and let us know how we can help you connect with this very valuable tool for our state and right here within our Billings community. Thank you, everyone, and have a wonderful day.